Congratulations! You have taken the most important step in any treatment path. You have sought education. Together, you and your partner, as well as your urologist, are identifying treatment options that fit your needs, and you've begun the rewarding process of regaining your active lifestyle. Hello, my name is Kurt McCammon, a urologist at Eastern Virginia Medical School in Norfolk, Virginia. I've treated hundreds of men, like you, men who for a number of reasons have lost their ability to control their urine. You are not alone. Did you know that 10 million men suffer from urinary incontinence around the world? Over 3 million of which are in the United States. Although this condition is not life-threatening, stress urinary incontinence can be devastating to one's quality of life because it can make everyday activities such as lifting, exercising, sneezing, or even coughing challenging and embarrassing. For many years, the solutions to treat incontinence were limited. Clamps, adult diapers, bulking agents, or drugs were the only answers and had limited effect. Now there is a new permanent treatment option called the Advanced Male Sling. The device works on its own without anything to operate or manipulate. Most patients are continent immediately following the procedure. I have personally implanted over 50 men with the Advanced Male Sling and have had tremendous results. It is a minimally invasive outpatient procedure that takes about 30 minutes to perform. The most common cause of stress urinary incontinence in men is the partial or total removal of the prostate gland during the treatment of prostate cancer. As a result, the external sphincter, which controls urine flow and affects continence, is damaged and cannot close properly, causing urine to leak. Many men suffer in silence, thankful that they survived their cancer. They restrict their activities and change their lifestyle out of a fear of embarrassment, from odor and wetness, or the discomfort of disposable adult diapers.
The world is not geared up for men having to change pads in airports and public places and things like this, and that's very difficult.
My lifestyle changed completely. Of course, the sexual activities with my wife was altered greatly. I would have to use a special, like a Depends or whatever, with a large pad, and even at that was not safe. So it altered my confidence of where I could go and what I could do and so forth.
The incontinence proved to be progressive, and it was more and more disabling as the years went on. I had hoped that it would improve as times went on, but it was just the opposite.
So I tried just about everything, and I took medication, different types of medication and things, and it really didn't improve at all.
I tried the Kegel exercise. For me, it didn't seem to work as well, but I did try it.
I have a dog that I love to walk, and walk a little bit, and I start leaking. You couldn't lift anything, and what happens, I ended up turning into a couch potato and gaining a lot of weight.
You know, it's been now 6 years, and during that time you learn to cope, and you learn how to basically get by, even though it wasn't that pleasant.
As you can see, these patients followed normally recommended treatment paths and experienced less than satisfying outcomes with adult diapers, physical exercises, or bulking agents. Understandably, you may be a bit nervous or apprehensive about which treatment option is right for you. Let's hear how these patients arrived at their decision to choose a permanent treatment solution that allowed them to regain their active lifestyle.
The issues with the pads became unbearable. You'd be out in a social atmosphere, invited to someone's home for dinner. You'd be sitting on the sofa, and all of a sudden you're wet, and so is the sofa wet, and you did not even realize it.
There was probably nobody that would be as apprehensive as I was. I've had enough surgeries, and I felt like I was beat up enough by the medical world that I was really, in my own mind, I wasn't going to do anything. You know, I was actually satisfying my wife by going and listening to what they had to say and everything.
My wife is a partner. She was in the decision making. You know, we were doing it together, and she's very, very supportive. Yes, I did it for myself, and I did it for her too.
While suggestions and advice from a trained urologist who specializes in the treatment of incontinence is important, nothing has more impact than real-life stories. Let's hear how these patients felt and what they thought after having the Advanced Male Sling implanted.
I remember waking up that evening. I had I was not dripping at all, and I did not have a pad on. I was totally dry for the first time in over 9 years. And was taking no painkillers. I had no discomfort whatsoever. I was aware of the fact that I had stitches, and we all know how that goes. You know, you get little scabs and get itchy and everything else, but I had no soreness, nothing else. All I did was aware that I had stitches. From that day on, I have been dry. I took no painkillers whatsoever. From the day of the operation on, I have not taken any because there hasn't been anything that discomforting. Psychologically, it took me a while because I didn't trust myself or the operation. And I kept remembering what the doctor said, don't do too much because that will cause the problems. And I did exactly what he said, and I behaved exactly like he said I should, not lifting things and things like this. And as time went on, I found out, boy, am I feeling good. Boy, do I want to go do this and that. And I had to keep thinking back on the time when the doctor says, don't overdo it until you're ready to do it. And I started working out again. I was walking my dog for 2 miles a day, and I used to not be able to walk a block and a half. And I have lost over 35 pounds. I felt absolutely fantastic. I feel like a man again, to be honest with you. I feel like my whole world's turned around. And I just feel great. I'm allowed to get around and do things that I need to do and want to do, and I can't think of anything that I can't do.
I was sore for a really short time. I really didn't do any lifting for 3 months. I try to, I exercise, I ride the bike and so forth. I couldn't do that for 3 months. But I was pretty impressed with the recovery. A good thing now, which I didn't have before, is that I have a distinct indication when I have to go, and I didn't experience that before.
I had minimal discomfort after the procedure. I was apprehensive waiting for the incontinence to return, but to my delight, it has not returned, and I have never worn a pad since the day of surgery. Complications were nil. The discomfort was nil, and the results have been excellent.
Your decision to have an implant is an important one. Let's go over a few key steps you should take before and after your procedure to ensure that you have a positive outcome.
No eating 8 hours before the surgery. Arrange to be driven home from the hospital. Be involved with the insurance process. Follow the post-surgery instructions. Keep your follow-up appointment and enjoy your new life.
Let me reassure you that Medicare and most private insurers cover the cost of this procedure. I recommend that patients be in contact with their urologist a few days in advance of the procedure to confirm that all the paperwork and insurance forms are completed properly. Also, this small amount of upfront attention will make for a more relaxing recovery period. Please realize that all patients recuperate at a different rate. Let's hear some examples of what you may experience after your procedure.
I feel like a normal human being, but I feel younger than I am because of the fact I went through all those years with the trauma of having the incontinence. So I sometimes forget how old I am.
I've gone from 6 pads to 6 large pads and a Depends to a small mini pad to regular underwear, which I haven't done for 6 years.
It has freed myself and my activities with my wife and I. We're not depending upon the pads. We can go on trips, we can go on day journeys. We don't have to worry about where the next bathroom is. I'm essentially unlimited. I can play golf as often as I want and swing as hard as I want.
During the 2 to 6 week recovery period, you should avoid extreme leg spreads or stretches, lifting heavy items, biking, swimming, and sexual relations. We've heard some fascinating accounts of how my patients were able to overcome their apprehension about surgery and choose a permanent treatment option to cure their incontinence.
For me, the advanced male sling was the best thing that has happened in my life because my life I was a couch potato and depressed, and I was told there's nothing that can be done.
I would highly recommend the procedure for males with incontinence, and I think the procedure has certainly been big lifestyle change for me.
The recovery time is not any more so than minor surgery. I definitely would do it again. It works for me, and that's all I can say.
Good luck, and thanks for listening.